My name's Brooklyn. I'm 22 years old, and a few months ago, I got into a car accident and I sustained a spinal cord injury at the T5 level. And in my spare time, I play a lot of video games. At the hospital, I got to work with this incredible rehab team. Now I'm home, and I would say that my biggest challenge is coping with autonomic dysreflexia. Autonomic dysreflexia occurs after a spinal cord injury at the level T6 of your spinal cord or higher. It has to do with communication between two important systems in your body: your fight or flight system, aka the sympathetic nervous system, and your rest and digest system, aka your parasympathetic nervous system. This can cause issues if a negative stimulus occurs below the levels of your spinal cord injury. So, even though you might not be able to consciously feel something could be irritating you below the waist, your body still reacts to it. Specifically, with autonomic dysreflexia, your sympathetic system reacts in a way that raises your blood pressure, and your parasympathetic nervous system reduces your heart rate. Autonomic dysreflexia math says low heart rate plus high blood pressure equals not a really good time.
Based on the work that Brooklyn did with her occupational therapy team in hospital and at home, they came up with the following occupational performance issue. So, how does AD happen? What does it look like? And don't skimp out on that neuroanatomy business.
In this image, we have part of your brainstem where blood pressure and heart rate are controlled, a thoracic spinal cord segment, T6, one level where sympathetic control of blood pressure and heart rate is, a line indicating the level of your injury, T5, and an area below the level of the injury that may receive input about the negative stimulus. Let's say the negative stimulus is discomfort in your thighs from sitting in the same position for a long period of time. With your spinal cord injury, you might not sense this discomfort, but your body will. Initially, this negative influence will send a signal that triggers your sympathetic nervous system around the level of T6 and below, which leads to restriction of blood flow by constricting your blood vessels. This is known as vasoconstriction. This will happen below the level of your injury. The reduced space within your blood vessels for blood to flow then leads to increased blood pressure. Increase of blood pressure triggers a reflex in your body that monitors blood pressure and regulates heart rate. This is called the carotid sinus reflex. In this reflex, receptors in your carotid sinus and aorta sense the increase of blood pressure and signal to your parasympathetic nervous system in your brainstem to decrease your heart rate, hoping to reduce the blood flow and eventually reduce your blood pressure. The receptors also will attempt to send signals to the sympathetic nervous system to tell it to decrease its efforts and widen the blood vessels. Unfortunately, in autonomic dysreflexia, this reflex is damaged, and the inhibition signal from the carotid reflex cannot reach the level of the sympathetic nervous system, so your blood vessels remain constricted with reduced blood flow below the level of your injury. This would cause you to remain in a state of high blood pressure and low heart rate, which can be extremely detrimental for your health.
Now that you have a better idea of what autonomic dysreflexia is, let's talk a bit more about the signs and symptoms that you and your family and friends should be aware of. These can include a pounding headache, flushed face, red blotches on your skin, and or sweating above the level of your injury. Goosebumps are another, fast and then slow heart rate, as well as nausea. When you experience these symptoms, you should sit upright in your chair with your feet lowered. It will be important to try and locate what is causing your symptoms. Common causes are a full bladder or kinked catheter line, or full bowels. You will want to empty both your bladder and bowels and check your catheter if you have one. Other causes are injuries or skin breakdown below the level of your injury. You want to check for these and remove any tight clothing or accessories. Sexual activity has also been known to cause mild to severe levels of autonomic dysreflexia. And this is something that we can discuss in further detail if you would like to. If you have a blood pressure monitor, it is also a good idea to check your blood pressure every 5 minutes to see if it is lowering. You should also call your doctor and let them know your symptoms, even if you start to feel better and your blood pressure lowers. If your symptoms occur again, or you're having trouble managing your symptoms, call 911. It is important to seek medical help as autonomic dysreflexia requires prompt management. If it is not managed properly, autonomic dysreflexia can become serious and lead to a stroke or death. We're here to support you and help you manage this condition. Yes, unfortunately, autonomic dysreflexia is a condition that can have a big impact as it can interrupt your studies, video gaming, and your everyday life. Unfortunately, autonomic dysreflexia is a condition that can have a big impact on your life as it interrupts your studies, video gaming, and everyday activities. To help prevent autonomic dysreflexia, it is important to create a daily schedule and routine for your self-care, including your bladder, bowel, and skincare. Be aware of the common causes and how to minimize the risk of autonomic dysreflexia. Now over to Julia, who will be talking about a few assessments she would recommend for you.
From the short time I have known you, Brooklyn, it sounds like you have great self-awareness, and it's very good that you were able to identify these symptoms of autonomic dysreflexia so soon and call your doctor. But given these symptoms and the current condition of your skin breakdown, it will be important for us to complete these little tests we call assessments to see if we can identify what's causing these wounds to form and what equipment would be most appropriate for you, as well as provide you with some education and tips to reduce future skin breakdown and still allow you to partake in video gaming. The first assessment that we will be completing is a skin assessment. So as you can see on this picture on the left, there are quite a few areas on your back, bum, and legs that are at higher risk for developing wounds or skin breakdown. I will go through each area and see if we can find any red spots or wounds forming, and if so, what grade. The grades can be seen on the right of the screen here and will help us as your healthcare team come up with the best plan to help you heal as fast as possible. Depending on where we find these wounds on your skin, we can also determine what the potential cause might be, whether it's your mattress or your wheelchair, for example. The next assessment we would complete is part of a seating assessment, and it's called pressure mapping. Since you already have a good wheelchair, this portion would just be a way for us to see where you apply the most pressure when you are sitting in your wheelchair and determine if a different cushion would provide you with better relief. So as you can see on this picture, we have that picture on the left that has a bunch of red areas, which are what we call hotspots. And then the picture on the right does not have that. So we will be doing something similar where we will ask you to sit on a variety of cushions and place a mat under it. And we will have little foam pieces that we can put under your bum as well to help you sit better. And we'll see if we can go from the left picture with the red spots to more of the right picture with less of the red spots. Some of the cushions that you will be sitting on during the assessment include a Roho cushion, which is like a giant air cloud, a Vicare, which has a bunch of different air pockets, and a Ride Java cushion, which is a foam cushion that has the ability to really conform to the shape of your bum. Each has great benefits, but we can see which one works best for you when we trial it. Based on what we have discussed, regarding some of the difficulties that you were having, we can also look at the option of getting you a standing frame, which is where we would have you stand for a duration of time to offload the area and allow you to reposition. But this will be in our future sessions once we do the seating first. Finally, I would come to your home and I would just want to see how you're playing video games. And if aside from getting the new cushion and potentially this fancy standing frame that we're going to discuss, we can make any adaptations to make you more comfortable while playing video games. Now over to you, Becky, who will be talking about an intervention we recommend for Brooklyn.
Hi, Brooklyn. My name is Becky. I'm also part of the occupational therapy team here to work with you. My role today is going to teach you a little strategy on how you can relieve pressure in those high target areas like the buttocks and your coccyx, also known as your tailbone. These are areas that are quite known for being at risk of developing pressure sores or any kind of wound or skin breakdown. So we want to really make sure that we're taking a preventative method in terms of relieving pressure there. And this is going to require a bit of diligence in terms of routine and scheduling and hopefully setting timers. And at first, I would like you to do this with someone in the room until you're comfortable with the movements and you get the hang of like the strength needed to do this. So you're going to make sure your brakes are on. You're going to take your arm and wrap it behind the back of the chair like this and use this kind of as a leverage or an anchoring point. You're going to take your other hand and place it on the railing, and then you're going to push up. And I need you to hold that for about 15 seconds. And that will provide relief on those high contact areas where you're sitting. And when you're done on that one side, it's really important that you do the other side so that you get pressure relief from both sides. So once again, behind the arm of the chair and then pushing up on the other railing. This will come a little more naturally for you as you practice the movements, and maybe eventually through exercise and strength building, you'll be able to do a double push and you won't have to lean to either side. It will be helpful to have a mirror in front of you so that you can kind of watch your body in relation to what movements you're doing and get a better feeling for what it's like to come back down and sit in a good posture. We'll have plenty of time to follow up, and there will be seating clinics that you can attend as well, and we can treat you with some more techniques as well.
Topic, autonomic reflexia.